حتى يدخلون الطلاب وتباعا. انا بالنسبه لي راح ابدي ان شاء الله. سمعوني
ماشي.
كلكم؟
نسمعك دكتور. تمام.
ماشي، يلا يعني ماشي. السلام عليكم. Welcome to our lecture. We will start the subject of surgery of the stomach and duodenum. As you know, the stomach act as reservoir for food, and also it serves to break down the food by a mechanical fashion into small particles and commence the initial steps of digestion before the
بس
نعم
ماكو مشاركة للشاشة.
نعم
دكتور ماكو مشاركة للشاشة.
ماكو مشاركة للشاشة. ها شباب سمعوني؟
نعم دكتور نسمعك، بس العرض
الشاشة تطلع.
تمام.
هسه واضحة؟
اي تمام دكتور، واضحة
واضحة هسه؟
واضحة.
Okay. As we said, the function of the stomach started as a reservoir for food, for ingested food, which is broken down by the action of the strong muscular contraction of the stomach. It will break the foodstuffs into smaller particles as the first step of digestion before these product or food, ingested food, are passed into the duodenum to start the second step in the digestion. Quick review of the anatomy of the stomach. The stomach is composed of a big muscular sac composed of three important layers of starting from the inner mucosal layer, followed by the muscular layer, and then the serosal covering. the stomach is divided into many parts, as you see in this figure, into a lesser curvature, greater curvature, the fundus of the stomach, the pylorus, the body of the stomach. All these parts of the stomach entirely connected to each other, and each one have a specific function to perform in the process of digestion. The venous drainage in this previous slide, we will show the arterial supply of the stomach. The arterial supply of the stomach is mainly derived from the celiac trunk through the left gastric artery, right gastric artery, and the right and left gastroepiploic arteries, in addition to the short gastric arteries arising from the splenic artery. So the majority, or the blood supply of the stomach is entirely derived from the celiac trunk through its branches. The veins are equivalent to the arteries, and I mean each artery has accompanying veins which drain all of the venous drainage of the stomach is directed toward the portal venous system. On the lesser curve, the coronary veins particularly important. It runs up the lesser curvature toward the esophagus and passes left to right to join the portal vein. This vein becomes markedly dilated. I mention this vein particularly because it is responsible for the development of venous dilatation in cases of portal hypertension. And you know, the portal hypertension, one of the manifestations of the portal hypertension is the development of varicose veins in the lower esophagus, which is part of the portosystemic circulation. When the systemic circulation form an anastomosis with the portal venous system. Lymphatics of the stomach is entirely divided into two plexuses. Nervous lymphatics of the stomach is entirely divided into three major lymphatic groups. Perigastric, I mean the lymph nodes that occur along the supplying arteries of the stomach, gastroepiploic arteries, left gastric and right gastric arteries, adjacent to the stomach wall. The second tiers of lymph nodes are located along the major vessel that supply the stomach. I mean the trunks of these vessels we have mentioned. And the third tier of lymph node located near the aorta, called para-aortic lymph node, along the course of the celiac trunk. So the celiac trunk is the third important lymph node tiers. The importance of lymph node are during resection of gastric carcinoma, we have to resect the accompanying and the adjacent lymph node which might be involved in gastric cancer. So these lymph nodes should be known for each medical student in order to define the lymphatic drainage of the stomach during any gastric resection for gastric cancer. Nerves of the stomach, either the stomach and the duodenum possess both intrinsic and extrinsic nerve supply. The intrinsic nerve supply is usually similar to that of the entire gastrointestinal tract. It is principally classified into two plexuses, the Meinturg plexus of Auerbach and the submucosal plexus of Meissner. Compared with the rest of the gut, the submucosal plexus of stomach, I mean the Meissner plexus, contain relatively few ganglionic cells as compared to the colon, as does the Meinturg plexus in the fundus. However, the antrum, the ganglia of the Meinturg plexus are well developed. The extrinsic nerve supply of the stomach is derived mainly from the vagus nerve As you know, the vagus nerve is the 10th cranial nerve fibers which originate from the brainstem, the vagal plexus around the esophagus condense to form two bundles into a left and right vagus nerve, which pass with the esophagus through the esophageal hiatus in the diaphragm. So the nerves identified as two large nerve trunks, anterior one and posterior one. The left one will become anterior and the right one become posterior. The efferent nerve fibers are involved in the receptive relaxation of the stomach. Receptive relaxation, I mean when you eat your food, the stomach should be in a relaxed position in order to receive the taken food. This function is mediated by the efferent fibers of the vagus nerve. The stimulation of the gastric motility and secretion is also mediated by the vagal nerve function. The sympathetic supply is derived mainly from the celiac ganglia. As you know, the celiac ganglia, the para-aortic ganglia, is arranged on both sides of the vertebral column and supply the majority of gastrointestinal tract, including the stomach, by these sympathetic nerves. Let us to discuss some histological review of the histology of the stomach in order to know the function of the stomach in an accurate fashion. We have to discuss or review some the histology of the stomach. The gastric epithelial cells are mucus producing, and it's rapidly turned over daily. So there is a continuous shedding of the gastric epithelial cells, which is rapidly replaced by newly growing cells. And also in the duodenum, there is a mucus secreting glands of Brunner. It's called glands of Brunner, responsible for secretion of large amount of mucus. Most of the specialized cells of the stomach, these are the mucosal cells, mucus producing cells. There are specialized cells in the stomach which are responsible for secretion of acid and pepsin, called parietal and chief cells, and found in the gastric crypt. As you know, within the mucus secreting cells or the epithelial cell, there's a gastric crypt. In the gastric crypt are lined by the parietal and the chief cells. The parietal cells are usually mainly concentrated in the body of the stomach, which is the acid secreting portion of the stomach, and line the gastric crypt, being more abundant distally. Distally, I mean distally within the crypt itself. As you know, the crypt of the intestinal crypt, the gastric crypt, sunk down within the gastric mucosa, and these parietal cells present within the body of the stomach, and especially within the distal part of the crypt. They are responsible for production of hydrogen ions and formation of hydrochloric acid. The hydrogen ions are actively secreted, so there's an active secretion needs energy consuming process by the proton pump, which is called a hydrogen potassium ATPase pump, which exchange the intraluminal potassium for hydrogen ions. So it is a process of exchange. This pump, it will take the potassium ions and secrete the hydrogen ions instead. The potassium ions enter the lumen of the crypt passively, but the hydrogen ions are pumped against an immense concentration gradient equivalent to 1 million per 1. The concentration of the hydrogen ion within the mucosa is 1, and in the lumen is 1 million. So if it is the process by passive diffusion, hydrogen ion will never diffuse to the lumen because the concentration within the lumen is very high. So it needs an energy consuming process in order to increase the hydrogen ion in the lumen against its concentration gradient. مفهوم شباب؟ مفهوم؟
نعم دكتور واضح.
Okay, زين. The second type of cells are the chief cells, which lies principally in the proximal part of the crypt and produce pepsin or pepsinogen, which is the inactive part of the hormone or the peptide. Pepsinogen is activated in the stomach to produce the digestive protease, called pepsin. So it is produced in an inactive form and then released to the stomach or the gastric lumen, which is activated by the hydrogen ions, by the hydrochloric acid, to form the pepsin, which is the active part or active component of the peptide. We have to know something about the endocrine cells of the stomach. Has a numerous endocrine cells which are critical to its function. I mean the function of the stomach. In the gastric antrum, the mucosa contain G cells which produce gastrin. Throughout the body of the stomach, there is ECL, enterochromaffin cells or like cells are abundant to produce histamine. These two cells, G cells and histamine producing cells, are the key factor in driving the gastric acid secretion. So if there is no G cells or enterochromatin like cells, there is no action of the other stimulant of the stomach to produce gastrin, like the قلنا قبل شوية شنو هو vagus nerve. So the vagus nerve is inactive in the absence of these important hormone producing cells. In addition, there are large numbers of somatostatin producing cells called D cells, although these function is inhibitory function. So these inhibit the gastric acid secretion and inhibit other GIT secretion. So it is made under these cells, in endocrine cells, اللي هي local effect on the GI tract or the stomach itself, produce balance between these two cells, between these different cells, result in a balanced secretion of hydrochloric acid. This is show the distribution of the vagus nerve along the greater and lesser curvature of the stomach, the anterior vagus nerve and the posterior vagus nerve. And the last section of the posterior vagus nerve calls the crowfoot. Crowfoot هذه nerves that supply the pylorus ring. بعدين نحكيها. If we want to do a vagotomy, we want to section of the vagus nerve, we have to preserve this crowfoot in order to preserve the function of the pylorus. The pylorus need to be relaxed during antral pumping, when the digested food, when the stomach complete its digestion, it pump this digested food, at that time it is called the chyme, into the duodenum by the action of antral pumping. It needs coordinated relaxation and contraction of the pyloric ring. This function is mediated by the posterior vagus nerve through these last nerves branches called crowfoot. Crowfoot يعني رجل الغراب. Duodenum is lined by the mucus secreting columnar cells, as we said, called the Brunner's gland, lie beneath the mucosa and are similar to the pyloric gland in the pyloric part of the stomach. The duodenum, or the endocrine cells that are important to be mentioned here, is the endocrine cells that produce the cholecystokinin and pancreozymin and the other hormone is secretin, which has a vital role in the motility of the upper GI tract and secretion of the upper GI tract, including the pancreas and the motility and contraction of the gallbladder and biliary tree. Let us to skip this. Phases in the gastric acid secretion. There are principally three important phases in the gastric acid secretion. Cephalic phase, this is mediated or stimulated when you take your food, when you see the food, when you taste the food, and when you smell the food. This central nervous system act or response in response to these stimuli will produce what we call it perceptive relaxation of the stomach and increase in the gastric acid secretion. The second phase is the gastric phase. When the food enters the stomach, the stomach will saturate, activating the neural reflex to stimulate the acid secretion. Peptide amino acid stimulate the G cells to release gastrin. Food act as a buffer, raising the pH. With many acid, food, it will dilute the hydrochloric acid, result in increasing the pH, then removing the stimulus for somatostatin secretion. يعني احنا عندنا بالانس بين السوماتوستاتين والجاسترين. When the stomach filled with food, this will stimulate gastrin in order to produce hydrochloric acid. More hydrochloric acid and more food will result in dilution of the gastric content. This dilution will raise the pH and decrease the stimulation of the somatostatin. So it is a balance between the somatostatin, the D cells hormones, and the G cell hormone in order to keep the pH of the stomach in a controlled fashion. The third phase is the intestinal phase, when the food stuff or broken food stuff at that time called chyme, the كروهة chyme اسمه CHYME. They were digested, the result of gastric digestion, which is pumped into the duodenum, called chyme. When chyme enter in the duodenum, this will result يعني معناها البروسيس خلصت of digestion والسtomach فرغت ماكو داعي بعد للهيدروكلوريك acid. الintestinal phase هو suppress the gastric acid secretion, so it has an inhibitory action on the gastric acid secretion. Investigations, method of investigation the gastric disorder. أهم واحد بيهن هو flexible endoscopy, flexible OGD يعني oesophageogastroduodenoscopy, the most commonly used and sensitive technique for investigating the stomach and the duodenum, gastric and duodenal conditions. We have to be careful when we perform endoscopy to avoid complication of missing important pathology. هذا مهم جدا انه careful endoscopy in order to not miss any important pathology like ulcer, gastric cancer, varices. بعدين نحكي بيها. The other investigations are axial imaging, including CT scan, MRI. It may be sensitive in the staging of gastric cancer, although it may be less sensitive in the detection of liver metastasis due to gastric cancer than other modality like PET scan or magnetic resonance imaging. The other technique is endoscopic ultrasound, when we have a probe, small probe introduced through the endoscope, we can detect some pathologies related to the gastric and perigastric diseases. These are more sensitive technique in the evaluation of T stage of gastric cancer. لأن بعدين راح نعرف ال T stage هي تعتمد على thickness of the gastric mucosa. يعني thickness يعني معناها invasion of the gastric wall by the tumor cells. This can be accurately detected by the ultrasound and accurately measured by the ultrasound. We can measure or estimate the thickness of the gastric wall invaded by the gastric cancer. The endoscopic ultrasound is a sensitive and good diagnostic technique for this purpose. Lastly, laparoscopy is very sensitive in detecting the peritoneal metastasis. The peritoneal metastasis, which is not inside the stomach, outside the stomach, can be detected by laparoscopy, rather than endoscopy. Endoscopy, it can reveal and diagnose mucosal surface, while laparoscopy can reveal serosal surface, يعني outside the stomach, can be detected by laparoscopy. زين. خلينا نحكي على الهيليكوبacter pylori. ال H. pylori اللي هي high important bacteria has make a revolution. The detection of H. pylori make a revolution in the understanding of the many gastric condition, including gastric ulcer, peptic ulcer, duodenal ulcer, and many types of gastritis, and the development of gastric cancer. Over the last 30 years, this organism has proved to be overwhelming importance in the etiology of number of common gastroduodenal diseases, such as chronic gastritis, as we mentioned, peptic ulcerating, and gastric cancer. One of the characteristics of this organism is the ability to hydrolyze urea. So it is a urea splitting microorganism, مثل ما أخذتوها بالميكروبيولوجي, resulting in the production of ammonia. والامونيا مثل ما تعرفون هو شنو هو؟ alkaline. الامونيا alkaline. The effect of ammonia on the antral G cells. احنا قلنا G cells sensitive element للاسيديتي. كل ما كانت الاسيديتي عاليه تقل, it will suppress the G cells, inhibit the gastric acid secretion. كل ما كانت الاسيديتي اقل يعني alkaline, كل ما G cells تتحفز, it will be stimulated to produce more gastrin, and more gastrin will stimulate شنو? enterochromatin cells and release histamine, and then release the hydrochloric acid. فإذا presence of this bacteria result in continuous alkalinization of the antrum, result in a continuous stimulation of the G cells to release the gastrin. This is probably responsible for the inappropriate hypergastrinemia in patient with peptic ulcer disease. يعني ابو البeptic ulcer اللي هو احنا من قلنا peptic ulcer. شنو peptic ulcer؟ يعني ulcer related to the presence of acid and pepsin. اذا ماكو acid معناها ماكو ulcer, ماكو peptic ulcer. peptic ulcer مو غير ulcer, مو malignant ulcer. لا, البeptic ulcer معناها اكو acid, يعني هي acid damage to the mucosa. وهذا الاسيد دامج منين يجي؟ معناها اكو عندي excessive acid secretion, وهذا excessive acid secretion يجي من هواية انواع, واحدة من عندهم هو continuous alkalinization of the antrum by the production of the ammonia produced by the bacteria, result in stimulation of G cells and overproduction of the acid. The organism has an obligate urate activity. It is utilized high obligate urate activity, يعني عنده enzyme which is يعني break down the urea and produce ammonia. هذه الخاصية قدرنا نستخدمها في تيست معين اسمه 13C and 14C breath test and flow test in order to diagnose the presence of these bacteria within the stomach. The organism is also detected histologically by taking a biopsy from the duodenum, endoscopic biopsy from the pylorus, using the Gemza stain or ethylene stari silver stains, and can be cultured in a special media in order to detect this organism. Previous or current infection of the organism is also can be detected by the high titer of the anti-H. pylori antibody in the blood. Other tests can detect the infection with this organism is the breast test and fecal antigen test are present as available as a laboratory test for the diagnosis of this bacteria. The infection with H. pylori leads to disruption of the gastric mucosal barrier by the enzyme produced by the organism. يعني احنا اي بكتيريا في الجسم مثل ما اخذتوا بالميكروبيولوجي, ستاف, ستريبت, عندها proteolytic enzymes. It will disrupt the adjacent tissue by these proteolytic enzymes, result in a process of inflammation اللي تعرفوها اللي هو تبي نيوتروفيل تجي وتجي الماكروفاج يصير degranulation of the proteolytic enzyme. It will cause destruction of the local tissue produced by the enzymes produced by the organism, and the inflammation induced in the gastric epithelium is the basis of many associated disease processes like gastritis. يعني من اكو عندنا infection by H. pylori. ال H. pylori قلنا هي عبارة عن بكتيريا فقط. It can colonize only gastric epithelium، بس الجاستريك epithelium. هسه واحد يقول لي ليش؟ لا شلون تصير duodenal ulcer؟ هسه بعد شوية نحكي. سمعوني شباب لو لا؟
سمعك دكتور تمام.
ماشي. هسه احنا عرفنا انه ال H. pylori only colonize and infect gastric epithelium. When it infect the gastric epithelium وعادة وين يصير؟ بالانترم، وممكن انه infection of the whole stomach تسوي لنا pan gastritis اللي هي result in inflammation, the usual inflammation of any organ. يعني ممكن اي بكتيريا inflammation of the soft tissue, of the tonsil, of the whatever bacteria. الاكشن مالتها بالاستومك نفس الاذر بكتيريا. تسوي لنا شغلتين: invasion of the mucosa and release of the proteolytic enzyme يسوي destruction of the local tissue in the stomach, result in gastritis. إضافة لذلك mainly affect the antrum، وهذه الانترم لخاصيتها البكتيريا هي نفسها انه يوريا سبليتنج مايكرو اورجانيزم ويسوي امونيا، راح يسوي لنا الكالينايزيشن اوف ذا انترم. والنتيجه النهائيه انه شنو راح يصير عندنا؟ شنو؟ اكسسيف جاستريك اسيد سكريشن، يصير هايبر جاسترينيميا واكسسيف جاستريك اسيد سكريشن. نتيجه هذا هسه عرفنا احنا الاكشن مال البكتيريا بالاستومك، مو تسوي جلوكال انفلاميشن وتسوي لنا جاسترايتس. زين الدودنم شلون يصير به؟ احنا قلنا ال H. pylori cannot infect other mucosa other than gastric cells. مثل ما حكينا وقلنا excessive gastric acid، هذا راح الجاستريك acid راح يصير excessive gastric acid secretion and the duodenum will receive more acid. The response of the duodenum to this excessive gastric acid output result in metaplasia. يصير metaplasia. شنو metaplasia؟ change of one type of epithelium to another type of epithelium. ماشي؟ metaplasia. It will change into some area of the change into a gastric epithelium حتى يحمي نفسه. راح يصير الابيثيليوم هذا in relation or in response to excessive acid secretion by the stomach يروح للduodenum. هل excessive exposure of the duodenum to the high acid output result in gastric metaplasia of the duodenum. الduodenal cells اللي هي مو gastric cells، duodenal cells تتحول قسم من عندها إلى gastric cells، gastric mucosal cells. زين من صارت metaplasia وتحولت إلى gastric mucosal cells، ذاك الوقت شنو تجي؟ ال H. pylori اللي هي شنو؟ can infect the gastric cells only. تجي تسوي infection للduodenal cells وتسوي inflammation of the duodenal mucosa اللي هي صارت gastric cells وصارت inflammation حالها حال الستومك. يسوي لنا هل sequelae of inflammation, release of the proteolytic enzymes, destruction of the mucosal cells and development of duodenal ulceration. زين إذا هسه عرفنا بالستومك شو يسوي لنا. The association of the organism with chronic type B gastritis is not in doubt. اللي حكيناه من يصير colonization of the bacteria to the gastric cells يصير type of gastritis called type B gastritis, which is type of gastritis related to the infection of H. pylori. سموه type B gastritis. بعد شوية نحكي على type of gastritis ونعرف. إذا سوينا inflammation of the stomach and gastritis which might be complicated by gastric ulcer. يصير ممكن انه gastritis وبعدين subsequent inflammation result in formation of an ulceration within the stomach called gastric ulcer. وبالدودنم همينا قلنا ليش يصير بالدودنم؟ لانه gastric epithelial cells metaplasia in the duodenum and then the gastric cell, metaplastic gastric cells within the duodenum can receive the H. pylori and can be infected by the H. pylori and result in the same process that happened in the stomach, resulting in chronic inflammation and the development of peptic ulcer or duodenal ulcer. The effect of the organism of the gastric epithelium is to incite the classical inflammatory response, as we said, that involved the migration and degranulation of acute inflammatory cells such as neutrophils, and also accumulation of chronic inflammatory cells such as macrophage and lymphocyte. حكيناها قبل شوي. تعطوني مجال دقيقتين بس اخذ ريست واجيكم. ابقوا على اللاين دقيقه واحده بس. ماشي شباب؟
ماشي دكتور.
ابقوا اون لاين دقيقه واحده.
ماشي.
شباب وياي؟
نعم دكتور.
يلا هين. So نتيجة انه it is evident now that H. pylori infection results in chronic gastritis by the inflammation اللي قلنا بهذا السلايد هسه قبل شوية. ulceration. عفوا. هاي the effect of organism in the gastric epithelium that to incite classical inflammation. عرفنا انه شلون نسوي الكرونيك gastritis والgastric ulceration. زين. And also how this may progress to gastric ulceration. But if a while it is remained that an enigma that as to how organism could involve in the duodenal ulceration, هذا ما كانوا فاهمين. بعدين عرفوا انه هذا اللي قلت لكم اياه. انه the normal duodenum cannot be colonized by the bacteria. اللي result انه شنو excessive production of ammonia does increase the level of circulating gastrin, and being shown subsequently that eradication of the organism in patient with duodenal ulcer disease reduce the acid level to the normal level. However, the overlap of gastric acid secretion between normal subject and those with duodenal ulceration is considerable, and increased acid level in patient with helicobacter associated enteral gastritis are insufficient to explain the etiology of duodenal ulceration. هذا قبل، بس هسه proved انه هذا اللي دا يصير، انه gastric metaplasia within the duodenum results in formation of يعني act as a recipient for duodenal colonization by this bacteria and the subsequent formation of duodenitis followed and complicated by duodenal ulceration. هذا الاكسبلينيشن اللي قلت لكم اياه، انه يصير metaplasia in the duodenum is commonly infected by the organism, result in formation of duodenitis, and it is the precursor for the subsequent duodenal ulceration. Infection with H. pylori may be the most common human infection. كل يعني endemic، اكو هسه بالكوميونتي عندنا endemic، كل واحد هسه ممكن اذا اخذ له بايوبسي، ممكن العائله الواحده يمكن يطلع بيها فد 70% of the family is infected with H. pylori. الروت of infection عاده هو شنو؟ فيكو اورال بالمطاعم، باللفات، بالاكل، هاي كلها mode of transmission. ومو كل infected person معناها symptomatic person. Most of them are asymptomatic. يعني ما عنده لا gastritis ولا ulcer, مجرد carrier. The incidence of infection within population increase with age. كل ما على الage كل ما infection rate يزيد. And in many population, infection rate of 80 to 90% are not unusual في بعض communities, and up to 50% of the world population may be infected with H. pylori bacteria. It appears that most infection is acquired in childhood and possibly of infection inversely related to the socio-economic group. So the high or socio-economic group has less chance to get infection, while the low socio-economic group has more chance, because the hygiene واحنا كنا فيه oral لانه هي hygienic process. كل ما زادت الhygienic تقل rate of infection. The means of spread has not been identified, but the organism can occur in feces, and fecal-oral route spread is the most likely route of spread. نيجي هسه للdiseases. Gastritis. Gastritis is the inflammation of the gastric epithelium. There are many types of gastritis. احنا قبل شويه ذكرنا type B gastritis related to the H. pylori. قسموا الgastritis into many types of gastritis. Type A gastritis. هذا هنا مو H. pylori. هذا autoimmune condition in which there is a circulating antibody to the parietal cells اللي هي اللي حكيناها acid secreting cells within the body of the stomach. This results in atrophy. همينة كانوا يسموها atrophic gastritis. Atrophic gastritis. بس هسه سووها type A gastritis اللي هي autoimmune. Result in atrophy of the parietal cell mass and result in hypochlorhydria and ultimately by achlorhydria. Achlorhydria, there is no acid secretion by the stomach at all. Hypochlorhydria, there is poor or deficient secretion of the hydrochloric acid by the stomach. ويا البارايتال cells تعرفون البارايتال cells responsible for acid secretion. احنا قلنا hydrochloric acid, بس وياها همينة responsible for intrinsic factor اللي هو responsible for شنو absorption of B12. لذلك دول البيشنتس اللي عندهم type A gastritis or atrophic gastritis من يصير parietal cell mass atrophy راح يصير عندهم انيميا اللي هي B12 deficiency anemia, يسموها pernicious anemia. ليش؟ لانه عندهم hypochlorhydria, achlorhydria, parietal cell atrophy and deficient intrinsic factor اللي هو مهم for absorption of vitamin B12, which is essential vitamins for production of hemoglobin, result in type of anemia called pernicious anemia. In type A gastritis, the antrum is usually not affected. زين. من الانترم not affected معناها G cells شبيها intact. والجي سيل sensitive علما للبي اتش. كل ما قلت البي اتش كل ما جي سيلز قلت البي اتش يعني معناها acidic. من اكو normal secretion of the stomach it will inhibit the G cells لانه acid اكو معناها G cells هاي. من يقل الاسيد يصير البي اتش هاي يصير alkaline. الجي سيلز شو يصير بيها؟ تتحفز على مود تو بروديوس مور هيدروكلوريك اسيد. هنا المشكله عندنا شنو؟ هنا مو مشكله بس الريزلت انه شنو؟ البارايتال سيل اللي هي الاند اورجان اوف hydrochloric acid secretion is atrophied, فماكو acid secretion، فالجي سيلز على طول stimulated. فاذا ذول المرضى من اسوي له الجاسترين ليفل شو يصير عندهم؟ very high جاسترين ليفل، بس شنو؟ بدون فائده، بس جاسترين ليفل بس جاسترين ليفل عالي وماكو اسيد سكريشن. هذا الجاسترين ليفل راح يسوي يحفز لنا من هو الخطوه الثانيه بالاسيد سكريشن اللي هي نهايتها بالبارايتال سيلز، بس بيناتهم شنو اللي قلنا عليها اي سي ال سيل اللي هي انتراموكروماتين لايك سيلز. شو يصير بيها؟ همين تتحفز اكثر من اللازم. هذه الموجوده بالبدي اللي ما صار بيها شيء، هي موجوده بالبدي بس ما صاير بيها اتروفي لانه الانتي بودي بس للبارايتال سيلز. will undergo hypertrophy, and these glands when become hypertrophied result in the appearance of microadenoma of the enterochromatin like cells of the stomach and become as identifiable small tumor nodule within the mucosa. Very rarely, these tumors may become malignant, and patients with type A gastritis are predisposed to development of gastric cancer, and screening of such patients with endoscopy is appropriate action. يعني هسه من اقول pre-malignant condition of the stomach واحدة من عندهم شنو هي؟ type A or atrophic gastritis. ماشي شباب؟ زين. Type B gastritis. There are abundant epidemiological data to support the association of this type of gastritis with H. pylori. مثل ما قلنا انه ال H. pylori هي responsible for type B gastritis. Most commonly, type B gastritis affect the antrum, عكس atrophic gastritis affect the parietal cell mass. And in these patients who are prone, mostly طبعا mostly مو قلنا ممكن انه affect the whole stomach سوينا pangastritis. In these patients who are prone to peptic ulceration, Helicobacter associated pangastritis is also a very common manifestation of this infection. But gastritis affecting the corpus only, يعني بس الcorpus بس البادي does not to be associated. ليش؟ لأن البرايمري انفكشن عادة يكون وين؟ بالانترم، وإذا يريد يمتد البادي، بس البادي واحدة بدون انترم very rare. زين. There are some data suggest that Helicobacter pylori involve the initiation of the process of this process. Patients with pangastritis seem to be most prone to the development of gastric cancer. ولذلك قلنا ال H. pylori أهميتها في development pathogenesis of peptic ulcer, gastritis and gastric cancer. فإذا هسه يعتبروها هي ال H. pylori number 1 carcinogen, grade 1 carcinogen, لأنه the association between H. pylori and development of gastric cancer is undoubtful. والريزلت شلون يصير gastric cancer؟ انه الانتستينال metaplasia هنا بالستومك الريسبونس to the infection with H. pylori ممكن تتحول الجاستريك cells الى intestinal type. Intestinal type يعني small intestine and large intestine with chronic gastritis and atrophy. Although the intestinal metaplasia per se is common, the intestinal metaplasia associated with dysplasia مع العلم ان هي common، احنا نريد حتى نوصل للكانسر لازم اكو عندنا شنو؟ ميتابليزيا، وقسم من عندها هذه السيلز راح يصير فيها ديسبليزيا. شنو ديسبليزيا؟ ميتابليزيا هو replacement of the normal epithelium with a normal foreign epithelium. يعني gastric mucosa يصير بيها intestinal type of mucosa، بس هاي الميوكوزا بعد هي نورمال ميوكوزا. هاي الميوكوزا مع طول مو مكانها ممكن انه قسم من عندها شو يصير بيها؟ يصير عندها ديسبليزيا. ديسبليزيا هي بعد تبدي بدايه الابنورماليتي اللي هي الانيشيشن اوف اول كانسرز. ديسبليزيا اللي هي abnormal cells but does not invade the basement membrane، يعني بعد ما صار كانسر هي بحد ذاتها كسيلز بدت بيها الكانسر سيلز، بس بعدها ما مسوي انفيجن، ما صار كانسر. يعني احنا الكانسر هو انفيجن اوف ذا بيزمنت ممبرين. ماشي. ديسبليزيا abnormal cells without proliferation. وراها تصير شنو؟ كارسينوما ان سايتو اللي هو كانسر. هسه ديسبليزيا abnormal cells without proliferation. Carcinoma in situ dysplastic cells which proliferate but does not invade the basement membrane. هاي شو يسموه ان سايتو كانسر اللي هو منشأ معظم الميوكوزال كانسر. ديسبليزيا، كارسينوما ان سايتو، بعدين انفيزيف كانسر. ولذلك دول البيشنت with chronic infection with type B gastritis يحتاجون انه chronic recurrent or يعني screening endoscopy in order to see or to take a biopsy from many sites in order to exclude dysplastic changes in order to initiate treatment before the development of cancer. Another type of gastritis هسه قلنا type A type B. هاي هسه reflux مو reflex. This is caused by enterogastric reflex، يعني الدودنم اللي هو كله الكلاين راح يصير reflux of the duodenal content into the stomach، والستومك هنا مهيئة للأسيد وليس للألكلاين. and it's particularly common after gastric surgery. بنسوي surgery نسوي anastomosis between the duodenum and the stomach اللي هو يروح البايلورس. البايلورس المهمة مالته انه يطلع باتجاه واحد وما يرجع duodenal secretion. هو هذا من يصير surgery للstomach or duodenum, it will disrupt this mechanism of pumping or the يعني الantral sphincter or the antral and the pyloric sphincter mechanism will be disrupted. So the alkaline duodenal content is allowed to return back to the stomach, causing inflammation of the stomach called reflux gastritis. Histological features are distinct from other type of gastritis. Although commonly seen after gastric surgery, it can occasionally found in patients with no previous surgical intervention in whom or who have had a cholecystectomy. Bile chelating or prokinetic agent may be useful in those patients as a treatment of choice, as a temporizing measure to avoid consideration of provisional surgery. Operation for this condition should be reserved for more severe cases. يعني شنو الاوبريشن؟ احنا نريد نقلل الريفلكس of bile to the stomach، فنسوي diversion نحول المسار مال bile from the stomach to the small bowel. مفهوم؟ زين. The other type of gastritis is the presence of erosive gastritis. Erosive يعني شنو معناها؟ نخر. This caused by agent that disrupt the gastric mucosal barrier. وأهمها شنو هي non-steroidal anti-inflammatory drug and alcohol are the most commonly affecting agent. The non-steroidal anti-inflammatory drug induced gastric lesion is associated with inhibition of the cyclooxygenase COX-1 receptor enzyme and reducing the production of cytoprotective prostaglandin in the stomach. مثل ما تعرفون الستومك هي release the hydrochloric acid، وهاي hydrochloric acid يسوي digestion لاي بروتين، والستومك الستومك بها مصل وبها cells، المفروض it will digest itself، بس رب العالمين خالق اكو فد protective mechanism الميوكوزال cells مو parietal cells، لا بالكريبت، لا الميوكوزال لايننج خلق لنا فد defense mechanism اللي هي اكو cyclooxygenase type 1 production of شنو prostaglandin. يصير البروستاغلاندين هذا عليه من على طبقة حامية للسيلز from the damaging effect of the شنو of the acid. هاي normally من ننطي non-steroidal anti-inflammatory drug اللي هي معظمها COX-2 و COX-1 inhibitors، ماشي، it will disrupt this prostaglandin protective cells, then it allow the شنو من يصير بي damage للprotective mechanism راح الاسيد اللي بالستومك it will damage the mucosa of the stomach itself، ماشي، فلذلك سموها erosive gastritis. However, it will taking long-term COX-2 inhibitors are associated with cardiovascular complication in common with many non-steroidal anti-inflammatory drugs. يعني شنو؟ يعني هذين الكوكس 1 والكوكس 2 inhibitors mostly يعني اكو عندنا many of the beneficial anti-inflammatory activities of are mediated by COX-2 and the use of specific COX-2 inhibitor reduce the incidence، لان هو عندنا احنا السايكلوكسيجينيز سيستم شنو هو؟ COX-1، فمعظمهم شركات الادويه طورت النون ستيرويدال انتي انفلاماتوري دراج اللي هي مهمه جدا لاهل المفاصل واز ان انتي انفلاماتوري ايجنت بالاوتو اميون ديس اوردرز، يعني ما يقدروا يستغنون عنها، طوروها الى شنو؟ سووها كوكس 2 انهبيترز اللي هي همينه يبقى انتي انفلاماتوري with less effect on the cyclooxygenase system of the stomach. Another type of gastritis هو stress gastritis. منين يجي stress? This is a common sequelae of serious illness or injury and it is characterized by a reduction of the blood supply to the superficial mucosa of the stomach. يعني عندنا هنا ischemia of the gastric mucosa ويصير inflammation و ulceration of the stomach يسموها stress gastritis. منين تجينا؟ بالserious illness أو injury. serious illness مثلا واحد عنده head injury، الألسر اللي يصير ممكن ulceration يصير بالستومك يسموه كوشنج ألسر أو كيرلينج ألسر أو بالاكستنسيف بيرن، واحد محروق بالحروق، يعني واحد محروق جسمه يصير عنده همينه ستريس ألسريشن and stress gastritic and ulceration of the stomach، يسموه كوشنج ألسر، إلها اسم يعني. Although common, this is not usually recognized unless stress ulceration and bleeding supervene. هسه قبل شويه قلت لكم اياها. عاده الكومن يعني ذولا serious illness مثل السبتيك شوك، patient severely ill، وين موجود؟ وين؟ بالانتنسيف كير يونت، عنده في درجه بيرن قويه more than 50% burn of the body، عنده severe head injury، ذولا serious illness or injury يصير عندهم element of gastritis، بس هذه عاده ما تبين اذا ما يصير ulceration وبليدنج. قبل شويه قلت لكم الايرلي gastritis might be complicated with ulceration and ulceration might bleeding. هذول نعرف من عندهم صار stress ulceration وgastritis من البليدنج، يصير عندهم هيماتيمسيس يعني vomiting of blood. This condition also sometimes follows cardiopulmonary bypass. Prevention high complication in those seriously ill or seriously injured patient can be preventing this sequelae of stress gastritis and the bleeding. طبعا البليدنج ممكن يكون horrible bleeding and lead to death, sometimes called severe bleeding and uncontrollable bleeding، والtreatment مالتها very difficult. فلذلك البريفنشن مالتها is better than treatment. The treatment may be very difficult to control bleeding from these stress gastritis and ulceration in those patients. فالبريفنشن شافوا افضل وسيله اللي هو by prevention of stress ulceration and bleeding from the stomach is much easier than treating it, and hence the use of H2 antagonist. ال H2 اللي هي histamine 2 antagonist responsible for the secretion of acid. حتى نقلل secretion of acid هاي الميوكوزا، احنا damaging effect مثل ما تعرفون الدامجينج افكت اوف ذا ميوكوزا هو من الاسيد، كله من الاسيد. ما طول صار بيها اسكيميا شويه، اذا اكو اسيد يصير بيها دامج والسريشن. حتى نقلل الاسيد ونقلل الدمج ونقلل الريسك اوف بليدنج ننطي يسموها H2 blockers or H2 antagonist with or without barrier agent. اللي هو شنو البارير ايجنت؟ هذا سكرال فيت. اللي هو شنو البارير؟ نشرب المريض، هذا المريض نشربه هذا سكرال فيت راح يخلي يغطي لنا الجاستريك ابيثيليوم، يلزق عليه شلون الصبه شلون الصبابه يلزق على الجاستريك ابيثيليوم prevent the damaging effect of gastric acid secretion on the mucosal surface of the stomach. Another type of gastritis is a Mentrier's disease. This is an unusual condition, usually rare condition, characterized by gross hypertrophy of the gastric mucosal fold. اللي تعرفوها يسموها روغي of the stomach, gastric mucosal fold, and excessive mucus production and hypochlorhydria. يعني هاي الترايت اكو عندنا hypertrophy excessive mucus secretion وhypochlorhydria. This condition is pre-malignant condition. I may present with hypoproteinemia. ليش؟ لأنه يصير عنده excessive mucus secretion وهذا الميوكس كله بروتين، راح يصير عنده diarrhea. He will lose most of the secreted protein with stool, result in hypoproteinemia and anemia. وأنيميا ليش عرفنا؟ لأن عندهم شنو؟ hypochlorhydria وgastric atrophy. There is no treatment other than ما بيها treatment هذا المينترير disease اللي هو عادة autoimmune disease أو genetic أو hereditary disease ممكن، اللي هو هذا اللي abnormality of the transforming growth factor. Treatment مالته should be with gastrectomy. We remove all the stomach by a surgery called total gastrectomy. The disease seems to be caused by overexpression of the transforming growth factor alpha, like epidermal growth factor. This peptide also binds to the enterochromatin, EGF receptors, and the histological features of Mentrier disease may be reproduced in transgenic mice overexpressing transforming growth factor. هاي بحوث سووها على المايس حتى يشوفون سووا Mentrier disease، سووا reproduction of transgenic على هذا transforming growth factor، سووا له transgenicity وسووا Mentrier disease بالمايس حتى يعرفون شنو الكوز of Mentrier disease. بس هو rare condition والdiagnosis مالته by endoscopy and biopsy طبعا والتريتمنت مالته by gastrectomy. اذا المنتريت ديزيز one of the pre-malignant condition. هسه كم pre-malignant condition صار عندنا؟ type A gastritis، type B gastritis مال H pylori، والمنتريت ديزيز. هاي صارت ثلاث types of gastritis which are pre-malignant condition. Another type of gastritis هو lymphocytic gastritis. This type of gastritis is seen rarely and it is characterized by excessive infiltration of the gastric mucosa by T cells اللي هي T lymphocyte and is probably associated with H pylori infection. همينة يعزوها لل H pylori infection. The pattern of inflammation resembles that seen in celiac disease or lymphocytic colitis. Other forms of gastritis include eosinophilic gastritis, which appear to be an allergic basis and treated by steroid and chromoglycate drugs. Other type of gastritis, which is granulomatous gastritis, usually seen in patients with Crohn's disease and sometimes tuberculosis. Other type of gastritis is acquired immunodeficiency syndrome gastritis secondary to infection with cryptosporidosis, which is a fungus. Phlegmonas gastritis is a rare bacterial infection of the stomach found in patients with severe intercurrent illness and it's usually a gonal event. يعني هيك accidental event. Thank you very much. راح نخلص اليوم، راح نوقف اليوم بهذا الميتينج ونكمل ان شاء الله السبت الجاي. ها شباب، اكو سؤال؟ اكو سؤال شباب؟ شباب تسمعوني؟
نعم دكتور نسمع.
خلصنا السيشن، خلصنا الميتينج اليوم اول محاضره. next
ماشي.
ساترداي اللي عنده سؤال يقول لي هسه. خاف واحد عنده سؤال على فد شيء، على معلومه شيء.
دكتور اكو هاي بالشات قاعد يكتبون.
شنو هذا؟ ما سمعت، ما شفته. خليه يحكي وياي، خليه يحكي.
ادري وجدان اذا سمعينه تقدرين تفتحين لي ميوت وتسولفين ويا الدكتور؟
دكتور.
نعم تفضل بابا.
دكتور الاتش بايلوري كان متأثر على الويت، يعني تسويني ويت لوس؟
الويت؟
اي تأثر على الويت؟
هي وحدها ما تأثر على الويت. produce weight loss by the disease process that affect the stomach. يعني إذا صار عندها gastritis، صار عندها ulceration، gastric ulceration طبعا، لأنه أبو الجاسترايتس أبو الالسريشن عنده يصير عنده vomiting، يصير عنده abdominal pain with food، فأكد تأثر على الويت by the disease process that it induce in the stomach. طبعا إذا سوت gastritis أو ulceration، بس إذا بس infection بدون يعني infection، خلينا نقول يعني asymptomatic infection، no, it cannot produce weight loss by the bacteria per se. It produced weight loss due to the effect on the stomach itself. زين next. اكو بعد هذا سؤال؟ شباب واحد يجاوبني.
نعم دكتور اسمعك، بس هو سؤال ماكو الظاهر.
ماكو سؤال. يلا شكرا جزيلا. Thank you very much.
تمام شكرا.